Hi, in this video I am going to tell you the top 7 things that I have learned in the year 2020 as a speech therapist. These 7 tips are going to be related to techniques, to advices and to teaching strategies and methodologies that you can use with your child. In this channel, I offer speech therapy tips, techniques and detailed activity plans that you can do within your house. So if this is interesting to you, make sure you subscribe to the channel, turn on the bell notification, and now let's get into the 7 tips for you for 2021. I have found that the best way to learn is to actually make the mistakes for yourself and realize that you've made a mistake and take time to reflect on the mistake and learn from it. That is why I have made this video, so that you can get some perspective from my mistakes or from my learnings. That's why I have made this video. I hope it is helpful for you. Let's go to the tips. I am generally a little excessive when it comes to planning, and even in our universities we are trained to plan for a therapy session beforehand, and planning is the most important tool that I have found with respect to taking therapy and teaching children skills. But I have also come to learn that sometimes I can plan too much. That is, I am too focused or I am too set in the goals that I have prepared for the child, and I am not open to what the child is contributing towards the interaction. So I might have created, like, this child has to tell me a story with 3 sentences per page, and I might be constantly questioning and asking the child, when the child is so eager to tell me about something else related to the story that happened last week in the supermarket with his parent. But I will totally miss it, and I will be so focused on my lesson and on my goal. But actually what the child is contributing to the interaction is so much more valuable than what set goals I have. So the first lesson I learned was that planning, I know, is always good, but don't let your planning cloud any type of open, meaningful interaction that can occur outside of your target also. Second tip is also related to planning. So when you plan for your child, for example, your child is speaking 1 word and next you want your child to speak 2 words in sentences. So before you immediately jump from 1 word to 2 words, I have found that there is a lot of areas that we have to target before we reach there. This could be in terms of teaching our children more verbs, more propositional phrases like on the table or in the bag. So I can give you an example of a child I'm working with. So this child already speaks in sentences. He speaks a few basic sentences. Now my next goal, what I wanted to do was I wanted him to combine sentences when he initially came to my clinic. And I started working on it, but then I understood that combining sentences was very difficult for this child, and I probed back a little. So what I did is I took a detour, or I took a U-turn, and I came back and I assessed the skills and the language concepts that the child already knew. So the child knew verbs, but he was not able to make sentences with verbs. The child knew pronouns, but he was not able to use pronouns in sentences. So there is a bit of a disconnect between what the child knows and what the child is expressing. So what I wanted to do, so I came back 1 step down in my goal, and my next goal was to make him use prepositions and pronouns as well as verbs within the context of a sentence, make longer sentences before we start combining sentences. So my second most valuable learning was to not just stick by the goals that we set initially, and to troubleshoot and to problem solve if a goal is not attained, and to see where we are missing and to come back again and try things a little bit more differently for the individual child that we are helping. The third tip is also kind of related to planning. In that is when I plan for a session, for example, I take 40-minute sessions, and in the 40-minute session I try to plan 3 to 4, 10 or 5 to 8 minute activities within the 40 minutes. I would keep in mind, so the first activity is this one, this is the goal I'm going to work on, this is the duration I'm going to work on, this is the trials I'm going to do with the child, and this is the second activity, this is the third, and this is the fourth. So I have certain structure of a therapy in my mind. But what I find is sometimes when I introduce an activity to a child and I tell them this is what we're going to do today, do you want to do this? And the child just straight out says, no, I don't want to do it. And I'm suddenly so lost. Oh, you don't want to do this? I prepared this for you. I had all these goals set for you. Why don't you want to do it? So at this moment, I cannot force the child to do this activity. Because if you know me and if you've been following my channel, we don't believe in forcing, or we don't believe in making the child do something that they don't want to do. So what do I do instead? I have to find what the child likes. So for example, this child, she specifically likes balls and she likes to touch things and manipulate things by hand. So I had to find an alternative immediately and work my previous goals into the activity. So the takeaway from this experience is that when you plan, when you want to do something for your child and your child does not want to do it, I think it is time for us to respect our child's decision and find what they really like and try to build our activities and goals around their preferred activities and toys. If you are liking all these tips that I've been telling you so far, make sure to check out my channel. I have a playlist of tips and techniques. You can check out that playlist and you can get all the other tips that I have shared so far in this YouTube channel. The fourth learning. So the fourth learning is something that I took earlier on in this year, something called the prompt. So the prompt is a methodology which teaches us on how to help children say certain sounds. So if you had been following my articulation video series that I will link in the information bar, which you can check out, I have told you how to help your child say the p sound and the s sound. So articulation refers to again how sounds are produced, and most of our children have difficulty with certain sounds. Your child might be hearing impaired, or your child might have apraxia or a phonological problem or a speech sound problem. So when our children have these problems, they're not able to get the certain sound in a word. So that time we are using something called a tactile cue. So each sound in the prompt framework has specific and different types of cues. So when you give that cue through the child's oral structures by touching their face and their jaw and their neck, you can help them produce that sound, and you can also help them produce that sound in words. So when I attended this training earlier on in this year, I was able to use it with children I see throughout therapy, and I could see that it really helped. So tactile cues to speech sound production was very useful this year. Just a small reminder, if you're liking all this content, make sure to like this video, because when you like your videos, YouTube knows that my video is good quality and it recommends my video to other people. So this is just for the YouTube algorithm and for me to reach more parents. So if you're liking this video, make sure you hit the like button, and if you learn something, please do comment on what it is you learned, and let's interact in the comment section. Okay, so that brings us to the fifth learning that I had this year. This is a bit of a tricky learning because I learned not to reinforce all behavior. I learned not to reinforce all good expected behavior. You're like, what, Priyanka? But if my child does something, I have to congratulate them. Only then they are motivated to do more, right? I thought this too. But it turns out that some children, they don't really like reinforcements. So what I do usually is, when I am working on a goal and the child says the word or says the phrase or the sentence, I get so happy and I start congratulating, I start clapping, I start giving a high five and all this. But something I learned is some children just don't like high fives. They don't like clapping, they close their ears, or when you give them a high five, they're just least bothered and they look around. So in these instances, this reinforcement is not helping. Right, so that's what I learned. So what I did for this child, these children, is that I found the things that they really liked. For example, one of the children liked to be tickled, or one of the children liked a different toy. So what I did was, I did not reinforce them every time, but I told them that we will finish this learning activity, and then after this learning activity, we can play for some time with your favorite toy. So this is how I reinforced them, and it helped. Okay, now we come to the sixth strategy, or the sixth learning that I had this year, and this goes back to another video that I made, which is the wait strategy for eye contact, and I will link it over here. But I found that this strategy was phenomenal for the child as well as for me as a therapist, and I am sure it will be for you too as a parent. Because if you just go through the video, you'll know the steps that you have to follow with this strategy. But what I really found was that when I waited for a child to respond, and when I was constantly just looking at them, paying attention to them, looking at their face and mouth and monitoring every behavior of them, I was able to notice so many things. The first thing was that the child's eyes were so expressive. Even if your child does have some behavioral issues or some eye contact difficulties, they would still give you an eye contact for just a 1 second or just 2 seconds. And in those 2 seconds or 1 second, you can understand so much about how involved the child is in the activity. You can understand their interest towards the activity. You can actually see them processing the input that you had given previously and thinking over it. And this also gives you so much idea about where your child is, how your child is able to think, what type of responses your child is able to produce, and when do they respond. So, for example, there's a child who I did the wait strategy, and if you saw the video, I recommend a 10-second wait time. But for this child, I expanded the wait time. So suppose like I would wait for 12 to 15 seconds with this child for a response, and in that 15 seconds I would just be looking at him intently and waiting for him to say something. And I can see that he sees that I'm waiting. He knows that I'm expecting something. So by the end of the 15 seconds or by the end of the 12 seconds, he volunteers a response. But if I waited just 2 seconds or 3 seconds, he wouldn't have volunteered because he knew that I was going to give another instruction sequentially. So he was so used to that and he didn't want to say it. But when I waited for longer durations, he knew that he is expected to say something and he volunteered a response. Even if it is not the exact 2 to 3 word sentence I was expecting, it was at least 1 word or two-ish words that he could say. So the 7th learning that I had is quite controversial because maybe 1 year and 6 months ago, I wanted to become a behavioral therapist. I wanted to go through the certification process of becoming a board certified behavioral analyst. And I was doing a lot of research through that, and I came to know in this 1 year from adults who have autism. They like to be called actually autistic adults. I came to know, I interacted with these adults and I found that they don't like ABA and they don't like behavioral based therapy because of different ethical reasons. And so this year my learning was that I have to be more open-minded and I should not follow or I should not want to do something that is thought of as a gold standard treatment when the person you are treating does not like it. From this experience of mine, your learning is that if you hear that a certain type of therapy is the best, a certain type of therapy helped your child the most, I would suggest you not to immediately try it, but instead find a therapist who is very flexible. What I mean is, it does not matter only what methodology you use or what technique you use. What also matters is the person who is giving you that advice or the person who is helping you through this process. Because somebody who is too rigid in their thinking and saying this is how I would like to do, this is the best approach, and who's not willing to change when things are not moving forward is not going to be very beneficial to your child's overall development. So find a therapist who is very flexible to any type of teaching techniques and to try different things to help your child. So more than the technique, I'd say focus on getting the right therapist. So these are my 7 learnings for 2020. Now that you have learned all the things that I have learned, you can be better equipped to help your child in 2021, and all the best for that. Check out these activities. See you in the next video.